From Toledo's news leader, this is WTOL News 11, your day.
All right, there's definitely some ingredients in food or drinks that aren't so good for us. We all know that, but instead of just thinking about what we're putting in our bodies, well, a new line of skincare products also conscious of what we are putting on our bodies. We are joined by Lisa Masad to tell us a little bit more about products on the Belli line. Good morning to you.
Good morning.
This is, when we talk about Belli, we're talking about expectant mothers. And this was actually developed by the wife of a doctor who was concerned about what she was putting on her body when she was expecting.
She had worked for a cosmetics company, and she had a closet full of lotions and potions, and she started looking at that, and she asked her husband, Jason, is it safe for me to be using all of these ingredients on my body while I'm pregnant? And he said, you know, I really don't know, but let me do some homework and investigate that. And as he started doing some research, he found that some very, very common ingredients that are in skincare products are linked to birth defects in medical literature. Okay. And so that can be obviously a big concern for moms, and we know that we do medications via our skin, pain medications, birth control, estrogen, nicotine patches, all applied to the skin, get into our bloodstream and affect us. And when you're pregnant, it can also cross into the baby and have negative effects on the baby. So rather than have to walk around with this list of what's safe and what's not, and scan every label of every product you're thinking to buy, what Jason and Annette did is they created the Belli line for pregnant moms, where every ingredient in every skincare product here has been teratology screened, meaning that there is no ingredient in any of the products whatsoever that has any link, no matter how remote, to birth defects in published medical literature.
Okay, and again, when you talk about the studies, you got to be careful to not to scare people.
Right.
I mean, you know, there's there's not a lot that has been published that is this huge risk, but if you talk about trying to slim your odds of it, this is what you're looking at, and there's a lot of lavender in here. I love this because it's very relaxing to moms. The smell, a lot of it's about aromatherapy.
Absolutely, and what we have done too is that we know that pregnant moms have very specific skincare worries and needs. So one of the #1 issues is we don't want stretch marks. So our #1 selling product is our Elasticity Belli Oil, which has that fabulous lavender fragrance that is used on a daily basis to help prevent stretch marks using Go2 Cola, vitamin E, and collagen hydrosylates. All been shown to help reduce the likelihood of stretch marks. That can be prepped with our skin exfoliator that helps allow it to absorb even better. One of the biggest concerns of pregnant women is hormonal acne. And unfortunately, a lot of the acne products that are available over the counter contain salicylic acid and benzoyl peroxide, which most OBGYNs say, you know, let's avoid those if we can. So we have an acne cleansing facial wash that is a lactic acid based product, which is very safe, and I personally use it because it is just a great, mild but thorough cleansing wash. And then your everyday items like your body wash, your moisturizing lotion, and a foot relief cream, because we sure know that pregnant moms get very tired, swollen feet. It's got a great peppermint fragrance to it.
Which is wonderful for swollen feet.
Absolutely.
So, and this is used by the stars, I guess. It's been seen in what, Courtney Cox, Angelina Jolie?
We know that Heidi Klum has used the products, Courtney Cox, Halle Berry, Kate Moss. We know that Brad Pitt purchased our pregnancy gift set for Angelina Jolie, and she looks pretty darn good.
Yes, absolutely. So we're actually going to put these in a giveaway if you're interested in perhaps getting them for someone who might be expecting in your world. But that's a good way to try to slim the odds. It's just so much to worry about when you're expecting, and this is one hopefully less thing.
It's better to be safe than sorry, and when in doubt, ask your OBGYN.
There you go. Lisa, thank you so much. Appreciate it.
Thank you.
Boys?